me, are we spending our money smart, in a smart way and in the right place, my answer would be not yet. But we're getting there with
Sure.
a lot of hard work. We're getting there.
Sure, and we have to work harder still.
We're not done.
Right. Now, and Al, again, what about the elderly and disabled who are in nursing homes? How do we get the message to them that they have a choice and they can come back home and be able to receive home care services?
Well, anyone in a nursing home, I don't care how they got there or who's paying their bill, anyone in a nursing home can have one of their family members or themselves pick up that phone that Dan talked about and call that 1-800-AGE-INFO, and they can ask, if they press 3, they ask to speak to the person who does work in the nursing home to help relocate people. Dan's agency, Mystic Valley Elder Services, and all the other 26 agencies across the state, they all have workers who are going through nursing homes, and they're doing assessments of people on an ongoing basis. So if there's somebody in a nursing home who's not happy there, who feels that they could be back home, and they're not asking either the nursing home nurses or orderlies, I want to go home and I'd like to talk to somebody about going home. They have to make some noise about it.
Sure.
If they're just quiet and they say nothing and they're just thinking, I'm not happy here, they'll stay there. But they need to speak out. They need to speak to our people. There's a nursing home ombudsman who comes around.
Oh, yeah.
Any of these people, the 800-AGE-INFO, the ombudsman,
Yeah.
our care managers, any of those people, we'll sit down and talk with them about what would be necessary. Now, not everyone can come home,
Right.
but there's a lot of people who can.
Sure,
We don't
that's
want to
so true.
over-deliver,
Right.
but we do want to hear from anybody who's feeling that this is not the right place for me.
Sure.
That's absolutely true. I can't emphasize enough what Al's saying is so important, that all our agencies across the state, in every single long-term care facility nursing home in the state, there are people going in, as Al said, either ombudsmen or folks from our staff, nurses, case managers, whose purpose is to help meet resident needs. The other thing that I should also add is that people in nursing homes, long-term care facilities, should not overlook telling the nursing home that they would like help relocating.
Sure.
There are nursing home discharge planners and administrators, and part of their job, and there are many good people who work in nursing homes. These are frontline workers who are doing, they say God's work, just as much as the frontline workers in the community. They're wonderful people.
Sure.
And sure, there are maybe a bad actor here and there, but for the most part, these are good caring people. And so people should tell the people who are working in these nursing homes, which are in effect the home for these people, that they would like a different home.
Sure.
And how can they help them make that connection to the community? We don't want to overlook the staff who work in the long-term care facilities as a source and have the responsibility to help their residents, patients, clients.
Sure. I think it's very important that we get the message out, because so many of them have no idea that they have a choice.
That's right.
Right.
Right, and the family may have resigned themselves that this is where mom's going to be the rest of her life. We're trying to get the message out that nursing homes are not your last address, that you still have options. I don't care how old you are, you still have options. You should be exploring those. And some people who go into a nursing home after a few months are ready to come back out. And we need to make sure that the understanding is that life is not a conveyor belt that only goes in one direction,
Right.
that sometimes people go into these facilities and come back out. Maybe they go in a second time, maybe they get hospitalized,
Right.
but life is dynamic, and at all times and at all settings, you should have your independence and your dignity and your privacy. I don't care what the title is over the door or where you are, your privacy and your dignity is your right, and you should fight for that no matter where you are and no matter how old you are. Make sure that you continue to get your privacy and your dignity.
Sure.
One of the things that people, I think, again, assume is that they go into a nursing home and they have to give up their home or their apartment.
Yes.
And so they feel like, as Al said, I'm on the conveyor belt, and the conveyor belt goes one way, and now I'm in a nursing home and I have no other place to go. That's not true, because we mentioned a little while ago that we talked about these programs like the adult family care program and group adult foster care and some of these other programs where an older person will go live with a family member or even go live with another family, a foster family, if you will. And so if the thinking is, I don't have my home to go back to, therefore I cannot leave the nursing home, it's not true.
No.
There are other good quality living options,
Yes.
whether you're living with someone else or whether you're moving to maybe an assisted living facility or a supportive housing program that are now cropping up across the state in public housing programs. So again, I think the message we both want to get across is
Sure.
there are options.
Right.
They're not, it's not easy, it's not A, B, C, D, boom.
No.
But that's why agencies like Mystic Valley and the people we have are care advisors, if that's really maybe the better term than a case manager. These are really professional people who are there to help assist you, the consumer, to figure out how do we meet your preferences.
Sure.
Not how do you do what we want you to do.
Right.
We want to help you get what you need and want.
And the
And-
key, yes.
No, go ahead.
I think the key to it all is there are alternatives. They
There are.
don't have to remain in a nursing home if they choose to come out and be in another facility.
Right.
Or-
If I can just give you one quick example. There's a case in point, a husband and wife who lives in our jurisdiction. And recently, the husband had Alzheimer's disease. The caregiver, his wife, had a series of medical problems. They both ended up in the nursing home. And effectively, everybody, the whole system, if you will, was saying to them, that's it, you cannot come home. The person with the older gentleman had Alzheimer's disease. He was in heavy care. He was having difficulty ambulating. He was on a feeding tube. The caregiver, the wife, had congestive heart failure, lots of medical problems. But she was bound and determined to come home. And frankly, over a lot of advice that it was not safe for her to go home, that couple is now home.
Wonderful.
And they're getting services from Mystic Valley. They're private paying. Fortunately, they have some means, so they're actually providing care. But here are two people who are doing well. They're happy to be back in their apartment. And frankly, had this been 2, 3, 4 years ago, I'm sad to say I would almost guarantee you they would not have been able to come home.
Really?
But they knew they had options.
Sure.
And they were assertive and said, and they had family members who were involved with this who also provided a tremendous amount of support and who are strong advocates. But it's working.
Sure. And there's also a place in Reading, well, there may be more than one place because there's assisted living homes also, but Peter Sanborn Place here in Reading is a great alternative for people who need to, well, they're in a facility where they have their privacy, their own little apartment, but they also have the care from, I believe it comes from Mystic Valley.
Yeah, basically I would put that in the category of what we call these supportive living programs, where you're independent, but there are services available if and when you need them.
Right.
And it's just it's so logical, it's so sort of, why didn't we think of this before?
Sure.
But that's the future,
Well,
is where people have the ability to get the services they need when they need them.
Sure. Well, I've heard of residents telling me that and they're just so pleased that they're able to have those benefits by living at Peter Sanborn. So there's so many various options for them if they do want to live in a home or a residential facility.
Right.
And remember, Sally, we're now allowing people to hire their own workers.
Yes.
And in some cases, we will soon be allowing people to manage their own budget. You know, they'll be given a certain amount of money and they will decide what to do with that money in terms of services that they want to buy.
Right.
So it's called self-directed care, where you hire your own worker, and also a program called Cash and Counseling, where you're given a budget and you work with someone who advises you about how to best use that money. So we're trying to put more power in the hands of the consumer, less power in the hands of the provider. Because it's the consumer's money. These tax dollars should be benefiting the people who paid into the system and helping them live independently with dignity. And that's where we're heading.
You know, I've heard of that program, and they can have a son or daughter or a family member or a grandchild care for them, and they can be trained as well. And how does the training part come in? I mean, what service do we have that gives them the training?
Well, in the personal care attendant program, for example, it's a combination of the elder or the disabled individual themselves training their worker to take care of them the way they want to be cared for.
I see.
So they will train them, and then they have access to a skills trainer who works with the elder to talk about, if you need help with eating or bathing and dressing,